Our next competitor is Rachael Zemek. Rachael is in the first year of her PhD in the Tumour Immunology group in the School of Medicine and Pharmacology. Her thesis title is Biomarkers for Immune Checkpoint Blockade. Her 3MT talk title is Cancer Immune Therapy, Responders versus Non-Responders.
As soon as you heard the word cancer, I bet you pictured someone undergoing chemotherapy. The current treatment for cancer is almost as terrifying as the disease itself, and it doesn't always work. The past 200 years of cancer research has told us one thing for certain: cancer is ridiculously complex. But in more recent years, we've also found that your own immune system can fight cancer. That's right, ladies and gentlemen. Your own immune system is the answer, but sometimes it needs a little push. So why doesn't your immune system fight cancer off like it would the flu? Well, unlike the flu, cancer develops from your own body cells. When your immune cells see it, they take a sample and say, "Hey, look what I found. I think we should do something about this." But because it kind of looks like your own body cells, sometimes your immune system says, "So what?" It's a bit like a Hollywood disaster film where there's some guy in a lab coat telling the president that the world is going to end. And of course they don't listen to him. They say, "Don't worry about that, that's normal." Now this is where the hero, immune therapy, comes in. Immune therapy is a new drug that tells your immune cells, it doesn't matter what the president says, we've got to do something. And so your immune cells go for it. Your T cells get pumped and angry and head for battle. However, unlike your favourite Hollywood film, we don't know if there's going to be a happy ending. For some patients, this therapy will save their life. Their cancer will disappear completely. But for someone else with the exact same cancer, they might not be as lucky. So what's the difference? Well, I told you cancer is complex, a bit like a million-piece jigsaw puzzle. And that's exactly how my PhD project's going to tackle this question. I'm going to look at what genes are turned on and off in cancers that respond and do not respond to immune therapy. Think of it as collecting all the pieces of a jigsaw puzzle. The exciting part is that with today's technology, we can now start putting pieces of this puzzle together. Once we do this, we can compare the two. What are the differences? What pieces are missing? And once I find out this, we can find new drugs that can change your gene expression. We can give patients those missing puzzle pieces or change it entirely. By doing this, we give patients a chance at responding to immune therapy. Therefore, more people will be able to beat their cancer, and potentially this will take us one step closer to a cure.